my name is John Miller. I'm nursing faculty at Tacoma Community College. I'm in the virtual world of Second Life on the island Evergreen 3, and I'm going to show you some patient interaction here. So let's go ahead and go into the medical facility. It's a 4-bed medical facility and educational area. As we come in here, you can see a patient in the bed. We also have a monitor up above with an ECG, heart rate, temperature, SpO2, respiratory rate, and blood pressure. Let's go over and wash some hands here for a minute. And I'm going to abbreviate for this washing for the purposes of the video. Maybe grab some hand sanitizer. We have several pieces of equipment here. We have a trash can in front of me, a sharps container, a gown and glove dispenser, a water cup for oral meds, a cart for ordering lab tests and other kinds of tests, a medication dispenser cart, and this is where the patient info and orders are also, a crash cart with a defibrillator, IV pump with PCA, some what we call pose balls where you can perform CPR. This particular patient has a Foley catheter in bed. And then way over on this side you can see the stethoscope, and that's for listening to heart, lung, and bowel tones. And on the very end we have a laptop to chart with, as well as we have oxygen above the bed. So the first thing we're going to do is actually take a look at the patient information. And we see that this is a 40-year-old female with shortness of breath. And let's look at some medical orders. We have an IV ordered at 100 mL per hour, digoxin, IV now, and titrate oxygen. And the patient says, "I cannot breathe, where's my doctor?" The nurse responds, "Okay, I'll give you some medications to help that. Are you having any discomfort?" So the first thing we probably do is put some oxygen on this patient. We're going to click the oxygen area here. We're going to connect it. It's actually already connected. We're going to increase the oxygen, maybe up to 4. And the other thing we can do is an IV solution out of the cart here. And we're using a special user interface we call a MUI, which is an attachment that your instructor will give you. And we're going to go ahead and select the solution, move that onto a tray, and then take it over to the pump area. I'm going to click on the pump. I'm going to transfer it over to the IV stand. And then we're going to connect the IV, as well as set the rate at 100. So now we're at 100 on the IV. Next thing we're going to do is go to the medication dispenser. And we need digoxin, just to double check that order. Click on menu and on medical orders. And it says digoxin 0.25 milligrams IV now. So we're going to go ahead and zoom in on the digoxin drawer. And we're going to remove the digoxin as well as the syringe. Put that on a tray. Take it over to the patient. Make sure it's the right patient, right time, right dose, etc. On this particular type of medication, we're going to click on the IV pump. We are set at solution is 100, like we said. We're going to go ahead and click on the IV site. And then we're going to go ahead and click on the IV line. And since this was supplied at 0.125, we're going to give 2 doses, 2 vials of this. So we're going to give another one. And there, we've given the digoxin. And if we focus on the monitor and see if the digoxin is going to have any effect, we can see the heart rate start to come down. And we can see the blood pressure come up a little bit. And if we're lucky, it'll convert the rhythm out of the atrial fibrillation. Checking the blood pressure. You can see the blood pressure is coming up nicely. And the heart rate's dropping a little bit. SpO2's come up. Respiratory rate is dropping to a better rate. And this concludes the demonstration of our patient sim area.